I had a discitis in my back about 4 years ago, and of course that made me pretty ill. By that time I had a serious spondylolisthesis of my lower spine, and it pretty much was totally slipped forward. One day I was in the park doing my usual hiking, and I literally just fell to my hands and knees. I mean, I could not take a step. I crawled out of there. The pain was so incredible. My doctor called down here to Dr. Frizzell. Dr. Frizzell said, I want you to see my friend Dr. Manning. He's the guy for you. And that's how I came to see Dr. Manning, because I had resisted surgery my entire life because I had never heard a good thing about it.
Joan is a fantastic gal who came to me at about age 61 with a real problem in her lumbar spine. She had a degenerative problem at the lowest level, but she had a couple other levels that were significantly problematic. And Joan had gotten to the point where she was just truly exasperated with her back, and she had a surgical problem that she'd been bearing up with for many years.
Well, you know, I've been to a lot of doctors, but there was something different. When I came to this office, the first thing was Debbie at the front desk. I mean, what an engaging woman. And then in walks Dr. Manning, and just from that moment, I just had all this confidence that I had finally found the people who could help me, and that this was going to be okay.
So Joan and I sat down and we looked at images together, and we talked about what were the potential options. And Joan is a tremendously active outdoors person, and so when we started to talk about recuperation and rehabilitation, and these were all considerations that weighed heavily, and ultimately we decided to go ahead and schedule it and get it fixed.
I mean, I can remember coming home from the hospital and getting up in the middle of the night and walking circles around my living room with a smile on my face, that I could do that.
Gotcha.
And just, you know, and then my goal to be able to take 2, 3, 4, 5 walks a day and walk 6 miles within a year. And I met that goal.
Joan was just so diligent during her rehab, and she followed all the instructions, and she would give us updates and tell us how far she was walking every day.
My whole lower back that had been hurting me since I was a teenager, I mean, it is cured. It's gone. I'm doing everything. I mean, I'm skiing, I'm hiking, I'm biking, I'm back live. I'm in the gym every day, which I'm a gym rat. I love the gym.
Joan would come into the office and she'd have a twinkle in her eye and tell me about the hiking trip she'd made, and which lake she'd hiked to that weekend, and it just made me super happy to hear how she's doing and to hear the success she's having with it.
I wouldn't trust anybody more than Dr. Manning.